Okay, so this is actually really probably the most frequent question that we are asked around of what we do most, BBL, body contouring surgery with buttock shaping, and this is why do so many patients actually do 2 rounds of BBL. Because to summarize it, patients always ask me, Doc, can I get a good result with the round 1? And I said, you will get a great result with the round 1, but you will probably want more. That is a big difference to needing more. And we thought we kind of highlight this a little bit. So the first question is, of course, how do we define or how do we rate a BBL result? Of course, we need rating standards, and no doubt patient satisfaction is our most important goal, but that's always a very subjective thing, as you will understand, especially if it mostly affects female patients. We, of course, need some objective criteria, and don't forget, it's a high impact procedure for the patient's mind too, so we need to find some rating standards, and otherwise, of course, we would be totally subjected to the arbitrary subjectivity of the patient. Now, the first, and probably the most important standard both for myself and for most of my patients is what we call the waist to hip ratio. The waist to hip ratio, as you see in this slide, is basically the green line, which is the minimum waist width in the costoiliacal triangle, which is in the lower back, and the maximum hip width. So you see in this case, this is what we would really define as a really good BBL outcome. Waist to hip ratio is really neutral, 1 or 0.98, which is waist and hip are nearly the same, so the shape is square. And we want to change it to a negative value, which is afterwards 0.62, which is a very slim waist and rounded hips. So this is actually what we set out to do. The second parameter that we judge is the projection index. Projection index means the narrowest point of the waist and anterior posterior view from the side versus the maximum point of buttock projection at the height of the pubic bone or pubic tubercle. These are the 2 parameters that we judge on. Now, what is the problem? We need to understand something about BBL when we communicate with patients, and that is something that I think for those of my peers who want to get into BBL, which I think is the greatest surgery of all, some people sometimes even underestimate it a little bit. I mean, the initial exaggeration of BBL is enormous. So patients look bizarre the first day after surgery, and the funny thing is most of them really love it. Yeah. So what I always make a very big focus on when consulting my patients is to say, look, bear in mind, when you see it in the mirror the first day, for heaven's sake, don't fall in love too much, because you're going to lose 50% of the volume, which is about 20% water loss and 20 to 30% fat resorption, which makes a total of 50%. And what I'm submitting to you, both surgeons wanting to get their hands on that surgery, as well as patients who are into that, is really don't get blown away too much on the first day. The psychological impact is massive. People often love it, and this is good and bad, because the good thing is they're very animated, they love it, it's overwhelming for them, recovery becomes much easier, but the small print, it doesn't affect a very big percentage of patients, but if you do many cases like I do, this is something that repetitively happens. They get so blown away with what they see in the mirror that despite excessive explanations before that this is not the result, they say, okay, this is not my result. And then that becomes a very difficult to manage situation. Because most patients, I would go as fast to say in my collective that is about 95%, are patients who go on a very positive spin. They say, look, great, you did a good job, I'm happy, my body looks totally different, I love it, I love the body feminization effect, but I really want what I saw in the mirror the first day. This comes in the nature of BBL, and I think this, nearly the totality of our second round cases, is what really motivates them. They lost kind of the fear of surgery. They become very motivated for your lifestyle and positively body conscious. So the second round is usually something that they do to dramatize something that they like and love anywhere. And now comes the thing which I sometimes find a little bit tricky to handle And bear in mind, this is when you do 800 to 1,000 BBLs a year, that becomes very relevant, and I would probably say it may possibly affect 5% of the patients. They lose a little bit the criteria. That means you have explained to them, and I think that's a very, very important point, in advising them before surgery, look, this goes down. There's a certain volume loss which is part of the procedure. But then they see this, they fall in love and struggle a little bit to accept what they've accepted before, and then you have what we like to call ITP situations, impossible to please, because if a patient compares the buttock to one day after surgery instead of one day before surgery, I think that's a literally unsolvable situation. I'll give you a case example so you see what I mean. Wonderful case here. I think that's actually a great outcome. You see this patient. It's an emaciated, relatively good body before. We do a BBL 1 round, if I remember correctly, 1,300 cc EBL fat grafting per side. Waist to hip ratio changes from 0.87 to 0.59. That is a pretty dramatic change. And that's what I always say. When you do this, dramatic might not be dramatic enough, because you see this outcome, you see this before and after picture, this waist to hip ratio, and the patient says, I look like before. And you say, yeah, excuse me? And this is something, that I find probably with the large amount of procedures we have always the most difficult thing to manage. However, I try to give you an explanation, because this, you see here the patient's on-table pictures, and for me it's a part of my treatment process to show them this picture, because it hell of motivates them. They love to see this, but you see that on the table, with the initial overblow before the volume resorption, and she actually did well with that. Her waist to hip ratio was even more dramatic, of course. But however, what obviously happened, she saw my picture, and then we had the problem that she loved it so much that she now seemed to think that this is the result. And that is a problem, although it sounds a bit surprising, but that with BBL surgery we do not see, I wouldn't say frequently, but from time to time. And that is always a little bit of a trap for patient satisfaction. And this is why I think it's a good case to demonstrate that how patients' expectations can totally derail, to say so, when they see that on-table shot. However, as I say, that is something that usually it is very effective to prepare patients for that. And my submission to all interested surgeons is make it a very, very important part of your consultation process to prepare them for what I call the first day blow. Because of course patients worry about all kinds of things which I don't think they really need to worry about, but what they often forget a little bit is the extreme psychological impact of that overblown look one day after surgery. They enjoy that massive body feminization effect, and most of them deal with that very well. They say, look, okay, I now understand what you're trying to tell me. I love that first day look. Let's do it again. And that's a very, very positive precondition. It's great, it gives you fantastic pictures, because the second round is often really an noticeable dramatization. So what we try to do is, of course, say, look, for our patients, and that is something that I recommend, you have a protocol for this in place, and say, look, what is going to happen? You're going to love that one day after surgery. You may get, let's say, a little bit addicted to this, and you might want to do it again. And then what we do in our patient management, we say, look, we of course we offer that to our patients for extremely reduced fees, because otherwise, if we were doing it like this, I could close my clinic tomorrow. And everybody seems to be happy with that. Very, very important, to give them a 1 month picture, because this is traditionally, I feel, the time when patients forget a little bit, what they looked like before, and that's a great moment for your patient satisfaction as a reminder. At least for the majority, it works really well. And what I'm saying to you is, whatever you do, I personally think that this surgery, BBL surgery, regarding outcome-wise is unbeatable in the positive way. And what I mean with that is it will reward you with very happy, shining patient. You will have great before and after pictures. However, you have to keep an objective criterion like the waist to hip ratio index, which I think works best for that. And the small print is that in selected cases, expectation management can be extremely challenging, because it's the most powerful operation, body contouring surgery that exists. But remember, the first day blow many forget what they have understood before, and we're living in 2020. You know, we've got the social media decade, and what I also want to make both patient and surgeons aware of is what we call so-called wanderers, or ITP patients, impossible to please patients. And I'm just describing a problem. I've got no solution for that, because it's sometimes very difficult, you know, to identify these cases before, you know, that is patients who actually probably don't want another body, they want another life. And then you have what we call the wanderer situation. They go from one surgical office to the next, they do one round after the other. And I can tell you, you know, if they sit in your office and they say to you, look, I think you do a much better job than the guy before, and you'll give me what I want, they're likely going to sit in the next office 6 months later and tell the next one the same thing, because simply they will never question the surgeon, they will only question the expectations. So, but in a box, for me, I insist that the most enjoyable procedure. But I think these things, you know, the management of patient happiness and minds after surgery is as important as is the actual surgery, and this will also be a big subject in our next life surgery courses, because I think there's a lot of things to share, a lot of things you will find amazing when you do that a lot. So it would be awesome to have a great crowd together in Marbella.